Hello, lovely viewers. Welcome back to the Kelvin TV. On this episode, I want us to talk about or dive into something very, very important. We are going to talk about 5 emergency skills every nurse should know or must know. This thing is very important and can help save life and can also help patients in an emergency situation. Whether you are a student nurse, you are a practicing nurse, or even someone who is curious about healthcare, this video is going to be very important to you, because these skills that we are going to learn about can make a difference between life and death. So let's dive into the video together. The first one that we are going to talk about is the cardiopulmonary resuscitation, known as the CPR. This thing is very important that all nurses must know how to do this procedure, because when a patient heart stops, every second count. So depending on cardiac arrest, it stops beating, or you can you can hear the heartbeat, or there's no pulse. Every second we are on count. So you, the nurse, you need to know how to check for the responsiveness. Then you need to make sure the airways are cleared out, or the airways are open. Then from that one, you need to know how to perform a high quality chest compression. So a high quality chest compression with a rescue brief to help save the patient or bring the patient back from the brink of death. So in case you are on the field playing football with all of a sudden one collapse, what are you going to do? You need to make sure the airways are cleared. You need to make sure the patient is responsive. So when the patient is unresponsive, that's when we do the CPR for that patient. So when we are doing the CPR, you do your hand like this, then you put this one here, then you place it at the center of the chest. Now pa 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 pa, then you give pa 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 for 30 times, then 2 times for the patient. So in all, you need to perform about 100 to 120 compression per minute. So 30 compression to 2 brief to 30 times, then for the patient. Let's continue, guys. The next one that we are going to talk about is controlling of severe bleeding. That is also another emergency skills that you need to know as a nurse, how to control severe bleeding. Should in case there is a cut or patient is injured and there is bleeding, what are you going to do as a nurse to stop that severe bleeding? Do you know that severe bleeding can lead to shock within a minute? Severe bleeding can lead to what? It can lead to shock. So what are you going to do as a nurse? One, the thing you can do for this patient, you need to apply a direct pressure. You need to know how to apply direct pressure to the bleeding sites. So then you can also elevate the limb. So in case the thing you can elevate that place. Then you can also use tourniquets or other things if necessary to help stop the bleeding, because bleeding can lead to shock, it can lead to dehydration and all those stuff. This might be like a simple method, but it can help a lot. So should in case you are student, you and your colleagues or you and your friends has gone to hiking or go to some places, and due to that there is a cat, there is this and that and that and that. These are some of the first aid you can do for the patient, but they are emergency things that you can do for the patient immediately when there is this situation and you want to control. Then the next one that we are going to also talk about is airway management. This thing is very, very important, how to manage the airways, because blockage in the airways means there won't be any oxygen to the body, or oxygen can't reach the body. So patient can collapse, patient can choke, and also patient can lose airways suddenly. What are you going to do as a nurse? So you can use some techniques like the head tilt chin lift. And I'm the head tilt chin lift, or can clear the airways. Then aside that one, you can also use the ambu bag to also clear the airways. Then you can also use some airway devices to also clear the patient's airways. So this thing is also very important, the airway management. so that you can prevent blockage and also other things from the patient's airways. Because in case there is blockage in the airways, means the oxygen ain't reaching the body, and due to that, we know what can happen if the body don't get oxygenated, or when the body don't get oxygen. The next one that we are going to talk about is recognizing and managing shock. This thing too is also very important, and it's also another technique that you need to know as a nurse, or you must know as a nurse, or a practicing nurse, or a student nurse. It is very important. You need to manage, or you need to recognize the shock, being it from maybe trauma, being it from blood loss or infections. You need to recognize it early, because failure to identify it early can be deadly. Failure to identify the shock early can be deadly. So first of all, you need to look for pale skin. If you want to know if the patient is in shock, you need to look for pale skin. There will be weak pulse, there will be rapid breathing, then there will be confusion. You need to look for these things. So when you find these things, the first thing that you can do to help the patient, you need to lie the patient flat. Then you need to calm them down. Then make sure they feel warm. Then you give them some IV medications or IV fluid like the normal saline, or you can also give the Ranges lactate, which are medications that you can use, or they use to treat shock. So guys, the next one that we are going to talk about is emergency medication administration. This thing too is also another technique which is very important when it comes to medication. You need to know how to administer some emergency medications like the adrenaline, the epinephrine, then anticonvulsants. This medication can be used in some conditions like cardiac arrest, seizures, or allergic reaction. We can give these medication. You need to know the correct dose, the amount that you need to give. Then you need to know the right route, whether being it oral, being it intravenous, being it intramuscular, or other things. You need to know the right route so that you can save the patient's life. If not, you can also, or if not, you will cause another complication to the patient situation. So know the right route and the right dose of this medication. You get me? Yes. You get me? Yes. So thank you guys for watching. Keep on watching Kelvin TV. I love you guys.